call our meeting to
Yeah,
order.
I'll call the meeting to order for Board of Health. And we have quorum. Supervisors do as well. Perfect. We usually start with introductions, so we'll just, I know there's some new faces in here, we'll just kind of go around. I'm Maggie Mangold, I'm a physician, I'm the chairperson of the Board of Health.
I'm Lisa Stab, board member.
Gina Olin, concerned, interested citizen.
Thank you.
Rick Bremer, supervisor.
Barbara Greenlee, Environmental Health.
Matt Even, Environmental Health.
Tracy Seaman, supervisor.
Haley Ripple, auditor.
Michelle Schoonover, Virginia Gate Hospital CEO.
Katie Cox, director of public health.
Ray Law, Benton County Attorney.
Becky Nowacek, I'm Region 6 Community Health Consultant with the Division of Public Health with Iowa Health and Human Services.
Roxanne Morrison, board member.
Awesome. Thanks everybody for being here. I do have the Board of Health agenda. So we will need to take a look at that. So if you guys have it in front of you, is there any additions or questions? If not, I will take a motion to approve the agenda.
No, you.
Second?
Second.
All in favor, say aye. Aye. All right. So, do you guys you probably have an agenda as well?
You do.
Do the supervisors know? Hi. I will just start with new business. I have Becky Nowacek here for overview of essential public health services and various county public health structures.
I did print out, I think, enough for everybody. So I'm just gonna, because I printed this after I created another one, so I will just hand it out here. Oops. Oh, it's together, yeah. Got it? I think I have 10, so I might be short.
You don't have mine. Actually, I have this. Here. I have this on another presentation you did. So if you need a copy.
They really are.
I can get additional copies too.
I was going to say, Becky, I was going to say you can take this because I do have this.
Thank you.
I think that's
In file. Did anybody else need one? Thank you. All right.
So if you guys want to share one.
Yeah, I was going to say, I have this.
So thank you for having me today. I was just going to kind of go over a few things about public health, local boards of health, and then open for questions that you guys might have as we open this discussion. This is informal, so please, if you have any questions, feel free to say you're going too fast, slow down, I have a question. So I thought the first and probably most important thing to do is really define what is public health, because many times there's not a true understanding of what public health is. So according to the CDC, public health professionals really prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. So really looking upstream. What is causing the issue upstream? How can we prevent this from happening? And how can we make changes so it stops happening? So in contrast, then we have the clinical professionals like doctors and nurses who, for the most part, are primarily looking at treating individuals after they are sick or injured. Public health also works to limit the health disparities. And a large part of public health is promoting healthcare equity, quality, and accessibility. This is kind of an Iowanized, what does public health do? Really, public health is a partnership with the state, local, nonprofit, business, policymakers, and really any other business or organization that are working together to protect and improve the health of all Iowans. And we strive to do this through a number of ways. We can do that for promoting healthy living. So when we talk about healthy living, many times people think about healthy eating, physical activity, nutrition, and also I think one that's really come up in the last few years is really that mental health or that brain health and how we make sure people are healthy. We can also talk about it as a preventing injury and violence, protecting against environmental health, and I see we have our environmental health staff here, so obviously we have staff doing that for the residents of Benton County. Assuring access to quality health services, preventing epidemic and the spread of disease, improving and supporting public health performance, and that's kind of where my role at the state comes in to help our local public health agencies and our boards of health is how can we look at, evaluate your programs and services, and are there ways that we can make sure we, looking at benchmarks and how can we improve them. And then preparing for responding to and recovering from emergencies. So again, this is kind of an Iowanize, what does public health do here in Iowa? When we start looking at code and administrative rules, a couple things to note is that the public health system here in Iowa is decentralized, which specifically means that each county has their own local board of health that govern the public health issues. If it was a centralized system, then everything would be governed by the state health department. And obviously with the home rule, we have those 99 counties to govern those public health agencies. Each local board of health has jurisdiction over public health matters within their designated geographical area. And when we say jurisdiction over public health, that may be different in different counties depending on some of the services they provide. It could be anywhere from personal health, which is that home health piece of it, direct care, hands-on, all the way to looking at the larger population of the county, environmental health, and even immunizations, because providing vaccines is helping prevent diseases. And so if you look further into Iowa Code Chapter 137, it states that local board of health have power and duties. So local boards of health shall, so I have the shall underlined, enforce state laws and rules and lawful orders of the State Department, make and enforce such reasonable rules and regulations not inconsistent with the law and rules of the state board as may be necessary for the protection and improvement of public health, and then employ persons as necessary for efficient discharge of its duties. Local board of health may also provide such population-based and personal health services as deemed necessary for the promotion and protection of health of the public and charge reasonable fees for those personal fee services. They may provide such environmental health services as may be deemed necessary for, again, the protection and improvement of public health, and issue licenses, permits, and charge reasonable fees in relation to the construction or operation of non-public water supplies and private sewage disposal systems. They may also engage in joint operations and contracts with colleges, universities, State Department, public, private, nonprofit agencies, and individuals, or form a district board of health. So in this case, Benton County Board of Health has subcontracted with Virginia Gay Hospital to carry out those services. And prioritization of public health services is necessary as a local board of health to fulfill their roles and resource stewardship and oversight to their county. When we dig a little bit deeper, our Iowa Administrative Code 77 really talks more about the local boards of health roles and responsibilities. And we lump those into three categories, our three core public health functions, which is assessment, policy development, and assurance. And then this is our wheel of our 10 essential services. So as you can see, each of those core public health functions has a number of activities or essential services that are listed under there. The CDC has a great document that actually lists out even more under these activities what services could be included under there. I'm not going to go into great detail with the 10 essential services, but if you are interested in knowing more about that, I'm happy to share that document with you. I will share, as we talk more about our local public health services contract, many of the services that are listed in the CDC document are now within the local public health services contract, because we want to make sure that our public health agencies are realizing what those services are and that they are going ahead and working towards meeting those 10 essential services in their counties. A question that we get quite often is what are some of those required public health services for our local public health agencies? I may be missing some, but this is the ones that we see most often in all of our counties. So it's required that you have to, boards of health specifically, impose and enforce quarantine and isolation orders. If somebody is on an isolation or quarantine order, they must furnish supplies and services or care during quarantine and isolation. So I like to kind of explain that a little bit, because sometimes that gets a little bit confusing as what does that mean. So if somebody had, let's say, active TB and they were homeless and staying in a homeless shelter, obviously they could no longer stay in there. So then it would be up to the county to find a location for that person to stay. If they can't afford it, that would be a fee then that comes back to the county for protection, and also provide anything that that person may need during that time of active TB. That's if they're under a specific order. And I don't know, Katie, I don't know if you guys have ever had an extreme case like that. No.
Latent. And providing treatment for folks, no, but yes.
Okay. And then also community disease investigation and follow-up is another requirement here for all of our counties. I think the state has been able to help our local public health agencies a little bit more in supporting what they can do with some of that community disease investigation and outbreak, with the help of some interns from the University of Iowa to help with some of those follow-ups. So I don't know, Katie, can you share like what follow-ups do you, because I know it's different in every county, which follow-ups do you work with?
So we do all of our follow-ups. We pulled the state in with COVID, at the height of COVID, about 6-7 months in. And then as, you know, we just kept getting further behind, then we used some other funds to pull back in and help the state get caught up with their COVID. But otherwise we do our own case investigations.
So there are some counties that have given the state specific, you know, the state will do some of the investigations for them if they don't have the staff to do that. It does say this includes assurance of STD and STI examination and treatment. It doesn't mean that the Board of Health has to have staff doing that as long as someone else is doing that. So Lynn County Public Health does that service for Benton County.
Yeah.
Also, immunization and dental audits is a requirement. So it is required that public health go into the schools and make sure kids are up to date on their vaccines, if there's any provisionals and waivers, and all that information is then submitted back to the department. And also child care centers as well. Assure enforcement of animal control, infectious and contagious diseases, rabies investigation, and quarantine. That probably is a discussion for another time, because I'm not sure what your environmental health does. That's perfect. Okay, so there you go. Private sewage. That's there. I take care of it, but private sewage disposal system. So that time of transfer, again, environmental health is here. And then the last one on our list is the assure completion of community health needs assessment. So the state does require our public health agencies to submit a community health needs assessment or a community health assessment every 5 years. In the past, we also requested them to submit a health improvement plan. So based on what they found in the community as the issues, what are some of those priorities, and how are they going to address those issues and see those benchmarks? Are they making any difference? We've never required that health improvement plan in the past, but starting next fiscal year, that is a requirement to the state that health improvement plan must be submitted to us, and we'll be also adding into our contract some progress reports that are required the years after. So we have a phrase that if you've seen one public health agency in Iowa, you've truly seen one public health agency in Iowa, because they are very, very different. The different staff, the number of staff that they have on board, the services that they provide, it's all very different. So this is just one map that we have available that looks at the organizations of local public health agencies as of June 30th, 2021. I will say this is a little outdated, because we do have one county that just went from a health system-based agency to a county-based agency for this fiscal year, and that is Carroll County. So the purple or bluish color are our county-based agencies. So what that means is our county local boards of health hire staff and are really that governing body for the public health services in that agency within the county. Our health system-based agencies, which are the whites, are what that really looks at is that the Board of Health have decided to enter into a subcontract with typically a health system-based agency to provide those services for them. What that means is that the Board of Health has more of an advisory role to public health services because they have entered into that contract with a Virginia Gay hospital or other hospital entity to do those services. So they don't have a lot of that oversight or governing piece to it that a county-based agency would have. This is just one structure map. We have some more data that'll be coming out hopefully later in the next couple months that we actually have. If you don't count what environmental health looks like throughout the state, we have 8 different structures throughout the state. If we factor environmental health into that, the number increases. So this year we don't have the data that would really allow us to do a great job on that report. Any questions about this? So another question that gets thrown around a lot is, so how does public health get funding? So obviously state grants and programs are a big piece of that. And I just kind of outlined some that Virginia Gay Hospital receives here. So the local public health services contract, our essential public health funding. We can talk a little bit that. I have a slide that's going to be coming up here in the handout that I gave you with the utilization. But in the past, these were where local public health could bill 19 activities for what they were doing, anywhere from home health services to more of those population-based services, and even like local board of health meetings and those types of things. Starting FY this past July, we changed our contract and the fact that we were looking at population health and non-population health. Population health really being those, looking at 3 required areas of work, leadership and governance, and then we had health promotion, and then strengthening the public health infrastructure. And we had certain objectives for each of those and activities that we wanted our local public health to choose for those activities. We made the requirement that 25% of their total allocation from our local public health services must be used on population health, and then no more than 75% could be used on home health, which would be, or the direct services, which would include those home health services or direct hands-on services. The goal for the next 5 years is to tier those non-population health dollars down. So this year, for FY24, we're going to keep it the same, no more than 75% for non-population health, 25% for population health. The following year, we're going to do 50-50. The next year, it's going to be 75% population health, 25% non-population health, with FY27 then being 100% of funds have to be used for population health. So this year, Virginia Gay could have gone ahead and done 75-25. They decided, I guess what we call it is flip the checkbook. Yeah. So what they're doing is using all of local public health services funds for population health activities. And then my understanding is then the county tax allocation is being utilized for the non-population health. And we'll talk a little bit about that funding stream here in a little bit. And then they also give public health emergency preparedness. Now, these are not my program area, so I don't know specifics about these, and I don't have access to a lot of that information. And then they have an emergency response multi-year program. I can just say that one it's messy, because it's just whenever another issue comes up, the state seems to put more money in there for public health agencies, and it's hard to track, and I don't know how anybody does that, so I really don't. They also have opportunity for federal grants and programs. Obviously, some federal grants come through that public health emergency preparedness as a pass-through from the state. The ability to bill Medicare and Medicaid. Again, not all public health agencies do that. Private insurance as well. Again, not all public health agencies are able to do that. Foundations or private grant opportunities. So this is where I think the community health assessment, health improvement plan are really useful. That if there are grant opportunities out there, people can look at what is in their needs of their community and look at funding to help address those needs. Donations are a possibility. I think it's very slim donations. I think this was typically, we saw this more for our public health agencies doing home health, specifically for foot care clinics. We don't see a lot of counties that do foot care clinics anymore. Fee for services, and then obviously the county tax allocation that is awarded to the county public health. Just a little bit of background. So this is the utilization of our local public health services funds going back to fiscal year 18. So as you can see, up until then, this is when we had those 19 billable activities. So 77% of those funds in FY18 were used for those our home health services. And so as you can see throughout the years, that's been predominantly the case here in Benton County. Again, for FY23, it's going to look very different in the fact that we're going to be seeing 100% of those dollars used for population health versus having home health on this chart.
For the state funds.
For the state funds, correct. This is just specifically for the state funds. And they roughly, let's see, for fiscal year 22, and I should back up. So our state funds, the local public health services funds, they're a contract with the Board of Health. So we always say the Board of Health are our contractors. They subcontract to do these activities. So back in FY22, the Board of Health received $62,867. So it's been roughly pretty consistent between probably an estimate around $60,000 that's been received, a little bit more than that each year from our local public health services contract. And it's because it's formula based. Each year we look at total population, poverty, aging. I'm missing one. I'm drawing a blank, I'm sorry.
Poverty, aging.
Low income, okay. Total population, poverty, low income as one, and then aging. I think that's why I was getting confused. So that's how our funds are distributed throughout the state each year.
And that's going to continue, correct?
We have a proposed budget out there that it's roughly the same,
Yes.
but
Yeah, and as the chairperson, the funds come to the Board of Health and then we subcontract that to Virginia Gay. So that contract is signed and renewed yearly. I have a copy of that contract from last year if you need it.
Yeah, because usually the checks come and we borrow and then we turn around and pay it.
Yep.
Right.
Okay.
one other thing that's
Just so I
different.
make sure I put the right amount in and stuff.
Yeah, so one thing that's different too, moving forward to our fiscal year 24 contract, is we're actually doing a 3-year project period, but it'll still be an annual contract. So just because it's state funds, we only kind of know what those yearly allocations will be. Yeah. So that's what I quickly threw together for a brief presentation. I'm really for you to understand public health in the state of Iowa, some of those requirements, some mays and shalls. I'm open for any questions that you guys might have regarding this. And I apologize, my contact information is not in your PowerPoint slide. I don't know why I wasn't thinking about it. I did that quick this morning. But please know that Katie and Maggie all have my contact information, so if you need to get in contact with me, I am here to provide guidance and assistance to the county.
So did I read this right? You're going away from home health care now?
We're not telling agencies that they have to stop home health. We're asking them to look at different funding streams for home health. What we saw, so our dollars are called essential public health services, and what we've seen over the years is a very small portion of Iowa's population was being utilized with these funds, a very, very small. And if it's supposed to be statewide, essential public health, how can we look at using these funds to really protect and improve the health of the whole community and not just a small
And
percentage.
home health is not an essential function of public health boards.
So what we have done, or what I did for this fiscal year, I kind of flipped that checkbook. So we are utilizing those funds through the state for 100% of the population health. And then with those county funds, then I allocated that amount so we could continue to serve, those non-population health folks. So I just kind of switched.
And when we're serving those, we're serving the ones that are on a sliding scale poverty level. It's like 1% of what we bill the other people that work for home health. And just, for me, myself, I've been in this for like 4 years, and yeah, like Becky said, I don't know why they were billing all the home health services under the local public health grant, which it should have went in my thing, to the county money. So yeah, we're kind of switching that and making that switch over.
And I think the other important thing to just note is that they're not, they're seeing those clients who do not have insurance or are not homebound,
Yes.
and those services can't be billed.
So they're sliding
elsewhere.
fees,
Sliding
correct?
fees,
Yeah.
yes.
And we use a sliding scale fee to perform those services.
How many clients do you have, just to throw a number out?
Currently, we have 9
9?
in the county, yep, that we're servicing.
Under
and-
that.
Yeah, under that, and it varies, we'll get calls from physician offices or, to help provide those services.
What, 60?
Otherwise,
60 to
yeah, our
70?
home health services in the 70s, but only 9 of
Yeah.
those folks currently are using those funds, so about $2,500 a month.
Oh, no,
That's what we're looking at, which, that varies. And then all of our other activities, so like our school audits and disease investigations and all of those things, all fall under those activities that we can bill to the state grant.
State.
So we're doing all of the services, it's just taking out of those funding and buckets.
I guess that was one more question maybe you can answer. On the immunization in the school, the kids and all that.
Yeah.
I know, I'm sure you ran into it, like, for religious reasons.
Yeah, the exemption.
What happens on that?
We speak to all of those families that choose those exemptions, and we honor that, and we have their forms, or they fill out forms for us to keep on file.
Okay.
But we circle back around, to make sure that folks are up to date, or if they need.
And as public health, we're not
information.
providing the vaccines, they're doing audits to, and that's a required function of public health, is to audit
Yeah.
and know what percentage of our student population is vaccinated.
So we do all our schools, all our daycares,
Do we have any of that?
How many, excuse me, how many children are there that choose?
I don't have that report, but our percentage was really high. We went over that, and I want to say we were over 95%.
We were. It was pretty good, actually, compared.
Oh, that's perfect.
Yeah.
So we want to, of course, encourage that and continue, so.
All right. Any more questions for Becky before the next thing on my agenda is actually segueing into that is for the proposed budget. But any other questions for Becky while we're here? Awesome. All right. The next thing on my agenda is review past public health budgets and the proposed fiscal year 2023 budget for county funds. So I'll let you take the floor, Katie.
Yeah, so I filled out the form that you had requested. So, thank you. So I had requested, looking at flipping that checkbook. Of course, we'll utilize our public health funds for all of those activities stated. And with this being the first year that I kind of put together this breakdown and Fed, we're discussing it. So the facility cost, or that overhead for public health to be housed here at the hospital, was $31,188 per year. We do provide 24/7 coverage as far as being accessible to the public for medication dispenses, those kind of evening events or community services that we do.
Question, Katie.
Yeah.
About that. If you're a salaried employee,
Mhm.
that does not fall under your duties then, that extra $20,000
This
for
does.
that on-call?
Yep, this is,
So
yep, that falls under my
it,
duties.
it's on you.
Yep, Amanda and I both take public health call, because we have, the state access to investigations, or, so that's split between the two of us. So that would be $20,000, $40. I allotted the $40,000 to continue those public health or non-population health services. So like we're seeing currently 9 folks in the county now, that kind of, approximately $2,500 a month, that kind of changes a bit, depending on how long we're with somebody or if it's a short-term case.
Katie?
Yeah.
So $2,500 a month total, correct? For all 9 people?
Yeah, right about
So
approximately.
that's $30,000, so where's the
Yeah.
other 10,000 of that?
So, and that kind of varies. So that can, like, if we have a couple more folks that we add on there, or if I have a project that maybe doesn't fit into these activities, then that can be billable back to the service. But it's kind of a guesstimate because our population changes. So I didn't want to
Okay.
go too short, because I'd hate to turn away somebody in need
Okay.
as well.
So are those still sliding fees
Yeah,
in that
that's
as well?
sliding fees,
Okay.
yeah.
Is that the same sliding fee that Virginia Gay uses for their own business then as well?
Yeah, I write the sliding scale fee based on every year, the poverty scale comes up, so I use that
Okay.
for us to go up on. And then the couple thousand left, I put towards just supplies and equipment, so paper, gloves, just those types of supplies. Otherwise, we have our non-population health activities come out of the LPHS grant. We have our BEP funds, which is our preparedness funding. We take all of our preparedness activities out of that grant. And then we have our COVID funds, which we will be ending at the end of June, that we use for all COVID response. So we have 4 different funding
Okay.
that I'm using.
And this was the first year that I saw a breakdown like this. Can you speak to budgets? I've never seen a budget for the county funds before. Can you speak to that?
Yep, we have some for you if you would like to look at. I believe historically that these were presented at the Board of Health. I'm not exactly sure, but
That
yeah,
would
I
be a
can
no.
pass those.
I've never seen a budget from.
I don't know if you want to pass those out.
Those were
So
what they
kind of
had
breakdown
presented.
for the county funds. And so, with us kind of switching that over, we
There's
track
not
that.
multiple copies, they were like, I think maybe it went back to fiscal year 18, 19, 20, and it's just a synopsis of what was spent for what categories.
Okay.
And so if you go to the second page down at the bottom, it says what our total expenses were, what the reimbursements we got, and
Michelle, were
if it
those
covered or
given
not.
to the auditor or to the board?
Part of it, I don't know, Barb, because I took over and then Melissa Smith did it. And they were supposed to, I was under the assumption that.
It was
they give-
happening.
That they give reports to the board every year with that information. It
But
was not
when you
here.
requested funds from the county, did you give them your budget or
Who?
the county?
No, we never did this before.
When was
I
this
saw the
created?
contract.
Because I've never seen this.
Yeah, they
Well,
have,
before,
I
I
don't know
don't know.
if Nancy started, do you know?
I
who
don't know
started
if
those
Nancy
budgets?
started it. I know when Melissa was here, one of the recommendations.
Okay, this is fiscal year 20.
Yeah.
One of the
we
recommendations.
continued that.
Yeah, one of the recommendations
because
I
we want
had.
to be transparent with you guys so you could see where it's going.
Right.
Yeah.
And, and when you look at 21 and 20, or my time frame, with COVID, those numbers were just off the chart. I couldn't quite track that, but then that was going to another funding bucket as we open up those COVID funds, but yeah. as
Yeah,
far
we
as-
received separate funds for COVID.
Right.
Yes.
Right.
So the county
So that
dollars
wasn't-
breakdown,
Yeah,
we
was
don't
not-
have that. Okay.
Right, but we were using, local public health service funds for our non-population health. So any of, like our disease investigations or, like our EQI or any other public health service would have come out of that.
And-
When you're
Yeah.
talking about county funds, do you mean what is it, 88 now or?
90, yeah.
something like that? Yeah.
90,000.
Go to the second page. Basically, those are all the activities we did. And then we put back in the reimbursements that we got from both the public health grant, emergency grant, and the county funds. That's underneath there. At the way bottom of the page. It has what our total expenses are, and then it has yeah. So most of the time, it doesn't cover everything.
And if you feel like it's not covering everything, you know, it's the county and the Board of Health's responsibility to be advocating to support public health measures in our county. I don't remember ever being asked what public health, the Board of Public Health felt was our goals or our priorities, or looking at this budget to see how can we either meet our budget or how can we advocate for more funds from the county. Our role, as from what I understand, the supervisors appoint us to advise and advocate, and I don't remember ever being asked to help set priorities or spending, how to spend these funds. So can you speak to that as to if you don't feel like we've had enough money?
Oh, no, I didn't say anything about that. You just wanted to know where the money went. And I guess I looked at it as we're contracted to do this, so we want to be good fiscal stewards of the county's money. So, you know,
And I know
we use what we get.
prior to me, I know that, you guys revisited that contract. And
But the breakdown of what is being spent, if you felt like the amount of money wasn't enough to cover what was needed to be done, asking the Board of Health to prioritize where we wanted to spend that money, was that ever considered?
No.
And I'm just gonna jump, I think that's the hard part too, because although it says, you know, the local Board of Health has jurisdiction for those public health matters, the contract is with the Board of Supervisors and with Virginia Gay Hospital, and unfortunately, I don't know if the Board of Health is mentioned.
It is
in that-
mentioned.
It is mentioned,
Is it
it's a
mentioned?
three-way contract.
Okay, three-way contract, okay.
And then I think too, actually, and so this is good because, yeah, they're changing it now. It started the next 5 years, it's a plan. And I've been trying to get somebody to look at the contract for 4 years, so.
I've been on the board for a long time, and we asked even before you came to have this contract reviewed. So this is, we had Becky come in and do a strategic meeting, I don't know, what was that, 6 years ago, 5 years?
Before COVID. The
Yeah.
strategic meeting.
So
it was like giving stuff to the
right before me.
So this has been a goal
Yeah,
of this
so, I
board
mean,
for a very long time.
We're willing, you know, what you guys wanna offer, what changes you wanna make, you know.
Looking at the amount spent, and you were 9,500 short, essentially, from what you got. Where did that money come from then?
The hospital absorbs them.
Okay, that's
And
what
you
I-
know, and we do our, well,
We don't make
community
money in
benefit,
home
we're a
health and public
nonprofit,
health. Yeah,
so.
we don't make money, yeah. It's
Not
more,
money we
I
can-
guess if you look at it as a community, a county service, that we're providing a service. Katie worked really hard during COVID, and who knew that we'd have a public health emergency like that? And it was beneficial to have her be a liaison between the county and us when we were working through all of that. So, you know, some of that stuff is like the community benefit that you do. And it's a good chance for us, like you said, to look at, okay, what things do we need to change? What things do we want to keep? I guess to answer your one question, Maggie, a lot of the funding, I think, comes from what the grant says, the objectives, the deliverables are going to be, because you can't just do whatever, you have to follow.
For the state funds now.
Yes, for the state funds.
And so looking at the supervisors to say what, you know, knowing this is a three-way contract, what we have right now, three-way contract between the Board of Health, the supervisors, and Virginia Gay. You know, what we're saying is we have not been asked the spending priorities. I don't believe that you have been asked, you know, to help set those priorities. Do we want to keep this the way it is? Are there changes that need made? And how do we move forward with that? So that moves us on, actually right along, to review and discuss public health services in Benton County and the subcontract with Virginia Gay Hospital. So I can just open that up. I don't know if either of you on the board have anything to say, or if we want to open it up to discussion.
Can I ask one question, kind of on this and the last topic? On the contract under subsection 5, it says the hospital shall make available the space necessary to accommodate the department, but we're paying $31,000. To me, that reads like we're paying for rent for space the hospital agreed to give. Can somebody just clarify?
Well,
that
that
for me?
shows where that out of that 90,000
Right.
into those services that are, being provided.
That says facility cost though, not services provided, so I'm just curious.
Well, it's like public health room.
It's indirect costs, like the extra things that we provide up here at the hospital. The phones, the fax machines, the.
HR,
Yeah.
fax.
But your point is in the contract, it says that they need to provide that.
Right, and you're an employee of the hospital, the public health director is an employee of the hospital. Okay, I guess I'm confused on that.
Well, it appears that you're half-time for
So,
public health.
I'm half-time.
And you're half-time for Virginia Gay.
Yeah.
Okay.
And Amanda.
She's full-time for Virginia Gay, but her
full-time.
time is split. Her paycheck comes from Virginia Gay because the public health funds go to Virginia Gay.
I see.
And we own the contract, so yes,
I
I'm a
see.
hospital employee, and I do half my time towards public health, and Amanda does half her time towards public health to provide services.
So they're reimbursed for
Yes.
their salary and
For-
fringe
for- yes.
for those
Yeah.
activities that they're doing.
So out of, where's my notes? There was grants that were given from the state. You can use those for salaries as well.
I can use those for those activities.
So that 19,000 that you were given,
Yep, through my
you
preparedness.
can use that all for salaries, correct?
I can use it based on the activities that I perform. So like for tabletop drills or like any preparedness activities, or like during COVID,
It
we
can
had
be-
the Dury show and I spent a week down at emergency management. So that is preparedness.
At your discretion then, basically? Or is there guidelines for
There's
that?
guidelines to every grant.
Okay.
So I keep workbooks, and to be able to use those funds, I have to write up proposals on what I'm going to use that for. So that's how, through those grants, approved and then.
So they have like a coding system in essence. So if they spend so much time on a certain activity, then they can code it to that activity that time.
And
Okay.
get that salary piece back.
Okay.
Yeah, it doesn't have to be on goods. It can be on time.
Time.
Yep.
Makes sense.
If that's what I understand you were asking.
Yes.
Okay. And same with the COVID funds. We got
200,000, so we were able to purchase our own refrigerator, our own freezers, use it for supplies, use it for COVID time, use it for vaccine, it's been kind of ongoing.
So a lot of that disease investigation, all that kind of stuff.
And we were able to
and I
collect
would
that back, thankfully.
probably say at least 75% of your time during the peak of that was billed to that COVID.
Absolutely, yeah, it was pretty much.
Almost all of it,
24
yeah. I mean, except the essential other things we had to do.
Yeah. All day, every day.
Put out fires.
Still not over. So.
No. All right. Braxton, do you have any other things right this second?
Not right this second.
Okay.
So when we're talking about the contract, are we looking at the most cost-effective way to utilize these dollars with staying within, keeping the contract, or is that the question when we're talking about the contract?
I mean, we have wanted this contract reviewed for a long time. It's really old in the
1994.
in contract speak.
Okay.
And, I know Ray said at the last meeting, this contract was made to save home health, is what he said. And so the whole concept of public health was different at that time. And so what do we want those funds to be used for? What do we want the contract? And I think the contract should reflect what that is. I would say, as a person on the Board of Health, I feel like we were appointed by the supervisors to advocate and advise for public health matters in this county. Otherwise they would do that themselves. You appoint a board to oversee something, and I don't feel like we have been able to serve that advisory role in the way that I would like to see that happen, to be able to set those spending priorities. And so when we look at this contract, that would be a goal of mine, would be for the Board of Public Health to have some say in what, this came up at our last meeting. You asked we had record suicides this last year. You can speak to that.
Yeah, last year in Benton County, we had a record number of suicides. That's 7, the most we've had since 2011 and 2014, which were 6. Ives has been tracking since 1990, and we have never had 7 suicides in the county, according to Ives. And I just asked for some data on that and for some funding, and we aren't really sure if we're able to do that.
We were told there wasn't room in the budget for that, and that was frustrating in that we don't. If that's something on our community health needs assessment, we have someone who's passionate about it. We're asking for a small amount of money to potentially work on a project to feel like the Board of Public Health. I don't know why we're there if we can't help set those spending priorities.
But shouldn't that come out of mental health? I'm talking suicides.
Where is mental health in that budget that you're looking at?
No, but shouldn't his concerns, shouldn't that be addressed by mental health or mental health agencies?
No, it's the public health. It's the public health
Purview.
Purview
And
too.
Becky did say that that's becoming an essential function, especially in the last few years of public health.
It's not listed as one now, though, is it?
But I would like to add is that with any of these funds, of course, we can discuss them. They're, and we can also see if there's other funding available. I think, I know that, this kind of goes with our ME service. And yeah, where can we take those funds from? Or if we wanted to look at, our state funds, is this something that would fit into that activity?
Well, I'm thinking,
or is this something that you're asking from the county? There's a lot of different buckets.
So something that we can think about is strengthening that public health infrastructure, right? Or even leadership and governance when we start talking about suicide. So if we start looking at some of those activities, that's really about building the community collaboration partnerships in order to start addressing some of those issues. So we can definitely look at those activities that are in the work plan.
And then that would be something to put in for the next fiscal year. Like we've already.
So we could budget money if you guys want to do some kind of like town hall or community event around suicide, that we could put that in our other line item within that contract for next year if we wanted to do that.
Correct me if I'm wrong, but that was an example. You brought up the great underlying issue that I don't want to speak for the other members of the board, but I don't think we feel like we're able to direct Katie's time as we should. I'm on a lot of other boards and committees, and the board as a whole really should be Katie's boss. We should be directing Katie's time to which public health function.
I hate to interrupt you, but the way the contract is now, we're a subcontractor. So I understand completely what you're saying.
Right.
So then I think you need to draft up a new contract if that's the way you want to go.
I just want to advocate for public health in the big picture, and with the changes that the state is doing with mental health illness care, DHS and public health combining. I've been following all of what I think her first name is Kelly Garcia is thinking and doing, and I just think that the processes that are going to have to happen to get wonderful, true, broad public health services, there will be a total restructure here. And that when I listen to you, Dr. Mangold, I hear what you're frustrated with. I was on the Board of Health before with Nancy Farmer and began to understand a little bit about that, but you're on the right direction in my opinion. And Ms. Schoonover, I've forgotten your first name.
Oh, that's right. That's right.
You're exactly right to me that this contract has to be examined and changed. And then we have to think about, Katie, I think I've talked with you before about the community needs assessment.
Absolutely.
When I was doing my own work for my nonprofit,
Yes.
I looked at that, and suicide and mental health,
We've explored a lot
substance
of funding
abuse
and different opportunities.
are just, this is all coming together beautifully for us in some ways, if we can figure out the correct relationships and who's working for who. In my estimation, a big thing is to double the leadership in examining the community and needs assessment and creating a vision. And that has to take a lot of time. Katie's tied up with tasks. Correct me if I'm wrong.
Got a lot going on.
Well, you're just barely keeping your nose above water, and we're asking her to really rise up and look at the big thing. And she's feeling that push, but is unable to do that because of contract and time,
Becky?
and salary and money.
Yeah, Becky, can you speak to some other, how other counties have increased their personnel?
Well, and so, we've run across some instances where the Board of Health, for whatever reason, the one that I'm thinking of specifically, Jones County, their hospital-based agency no longer wanted to provide those public health services. So what happened is the Board of Health had to make that decision on if they're gonna subcontract someone else or provide those services within their county. It came to be that the public health agency that was close to them couldn't do all the services that Jones County truly needed and wanted for their community. So they ended up hiring a part-time person to be that public health coordinator, not really a director, it was just a one-person show with that coordinator. And then since COVID and everything else that has come on, they have, obviously there's been staff change, but they are now up to 2 full-time people. There's been a slight increase in county tax allocation that has gone to them, but I think a lot of that is just due to the additional work that was put on them during that COVID time. I don't know the specifics, but we also have another county, like I said earlier, Carroll County, that went from a health system base to a county base just this year. I have their contact information that I'm happy to share. But we haven't seen that increase much in the hospital based, just because that funding isn't there to support that.
Becky, did they give you any check and balance? This was good that happened with this. This was bad that happened with this.
I can share Jones County hindsight. I was really new in this position when this took place. And one of the things that I wish we could have gone back and done is really examine at that time whether they wanted to do a combined public health and environmental health department. Because as of now, it's a separate department. And there's issues with that currently. So if I would have known then what I know now, that is one thing that we would potentially have looked at. The positives, I think, for them is that they have, just because the hospital they were subcontracted with was actually based out of Cedar Rapids.
Sure.
So they had more visibility, they have more partners now that they have somebody in their community as their public health agency. So this is a little different instance in that Virginia Gate Hospital is here in the community, but I think that's probably their biggest pro, is that there's somebody there, there's a
Any
face,
cons?
there's a name.
What did they say went wrong or isn't working?
I think it's just how it's set up currently, that with the 2 separate departments and budget-wise.
And were they able to apply for more grants or more funding opportunities?
Because of what they were wanting to implement, they went for those private foundation grants. They had people that could help write some of that stuff. And they have someone that right now currently spends a lot of time on social media and is able to push things out there for their community. I will say, if you look at health system-based public health versus county-based public health, I think there's pros to cons to both, right? I can only speculate because I don't know the specifics. I would say county-based, probably the challenges are looking at some of those resources. Is there space for a county-based agency? That's going to also, need a little, probably additional help from, I'm guessing, the auditor for HR purposes. Are the Board of Supervisors wanting to be that employer of record if they're a public health agency? Is going to take a little bit more time from our boards of health as the governing body being involved in that. Some of the, and then you have pros, obviously someone's there from the county, their name's there, they're county employees. I would say for hospital-based, you have some of those resources, you have that HR department. I will tell you, this is just from in the past when I had to do compliance reviews with our public health agencies, the hospital-based public health agencies who were also doing home health, it was so much easier to do a compliance with them because they had a designated HR department. So I know that's a huge resource. And just some additional resources that the hospital has. and maybe some of the cons are that you don't have the Board of Health that has that directed governance over that staff. They are a staff of Virginia Gay Hospital, and you're only providing kind of that advisory council. However, the Board of Health is still that contractor for state grants for most of them. So in that subcontract, you can really spell out what some of those expectations are as a board to your subcontractor.
But Michelle was saying that Virginia Gay is picking up what we're not out of some of these grants.
Yeah.
It's being absorbed.
Yeah.
They're doing it. There's no dollar amount put on that, correct? You're just absorbing it. Or do you have a dollar amount?
Yeah. That's also, you know, another
That's-
positive thing that you have somebody in the community that can
I
do
mean,
that.
they're absorbing, so that's something that I think we need to look at as well. Are we not getting enough money there? If they're absorbing, how much are they absorbing? Do we do some that's in charity? Some of it. Do we write some of that off as charity? I'm assuming we do.
Yeah,
Yeah.
I'm sorry, I don't have all the nitty gritty
But I'm
financials.
thinking
But
that
it's been
some
a
of this
learning
is
process, just figuring
it's
out.
charity, you know, and some of it probably would be written off as charity.
Well, in the last few years, of course, things have really changed for public health, obviously, the pandemic. So there's a different attention to this
I have a question about for Ray. Knowing that the county dollars, there's a portion of them that are being allocated to home health. Are we in any compliance issues? We have other home health agencies in the county. Are we in any compliance issues by not allowing other home health agencies in the county to use those funds or apply for those funds?
It's gonna be a long list.
You're talking about just the county funds themselves, right?
Right, because in the proposed budget, 40,000 is earmarked for non-population health.
Right.
So are we, I mean, and this is a question that I posed in one of our questions we had probably 6 years ago when we asked for this contract to be reviewed, which I know did not involve you, but is something that has made me feel uneasy. We have Keystone Home Health, Lutheran Home Health, Unity Point Home Health. I know they all provide charity care, and they do, you know, for people that can't afford things, most of those nonprofits have to have sliding fee scales or other things. So they're providing similar services. Are we in any compliance issues by not having opened this up for bids?
That's a good question,
Well, that's a tough question.
because we can't give it all to one entity.
I mean, I guess my initial thought was it probably should at least look at that as an issue. I mean, I can't, without knowing, first of all, not knowing where this is going to go in terms of, you're talking changing in governmental requirements. But-
There are no changing in governmental requirements for the county funds.
My initial thought would be we should, yes, without doing some more research. So my hesitation is that we're talking a home health service that may be required for the county to provide.
No,
It's not
it
a,
is not.
At this point, it's not, but, so, I guess my initial response is we probably should be doing that.
And right now, the state is going away from home health even more, correct,
Right.
is what you said? It's at 100, going to be 100% by fiscal year 25.
We cannot.
So can you, Becky, what are other states, according to your map, there's what, maybe 15 that are health-based and the rest are, I mean, just quick guesstimating, what are other counties, especially our size, doing? Are they going toward home health, or health-based, away from health, towards county-based, what are they doing?
Again, because they're so different, it really depends on what their priorities are. I have one county that, it's bad to say this, but they are a public health agency doing a lot of home health and very little public health. So they're one of the ones that are doing 75% of that non-direct services and just that minimal 25% population health for this year. And I expect they'll do that until we require them to do more public health. So some of them are doing that as they can, and then others are switching the checkbook. They're using those state funds for population health, and they're using those dollars from the county for non-population health because they still feel that that is a need within their county. And it's really looking at it, it's probably better to use county funds for residents within their county than to use state funds when we're supposed to be looking at the whole population.
But regarding the model, health-based versus county-based, what are counties doing? Are they shifting away from one or the other?
It ebbs and flows. We've had a couple that have gone from hospital to county. 2 years ago, or right before COVID, we had one that went from county to hospital. And I've had one Board of Health reach out to me that their Board of Supervisors would like them to consider going to hospital. So again, it ebbs and flows and depends on the politics within the county and what they're seeing and what they want to do.
As far as workload, what was Jones County is the one you said is closest to ours that's been recent. What was their work, or what was the employee part-time, full-time, half-time? What was their employee? Because they're at 2 full-time now, correct?
They're at 2 full-time.
What was their employee work status before switching to the county? Do you know?
They were not with the county, so I don't know. I mean, before I think they used all of their dollars for home health with that subcontract with Unity Point, the state dollars, and then county tax dollars also went to Unity Point to do those, but they were doing home health and just the bare minimum of community disease follow-up and that community health assessment. Just those few things that they needed to do.
Thank you.
I don't have a strong feeling one way or the other. I truly don't. I would like to see whatever contract, if a new contract is made, that gives the Board of Health, that spells out our role in helping set priorities and budgets. I think there's a lot we could do for public health in the county. And when I look at the proposed budget, I mean, there's things that I question if we could trim and could do other things with. But ultimately, it looks to me, right, you can say one way or the other, this is a 3-way contract between the supervisors, the Board of Health, and Virginia Gay. And so that's why all 3 parties are here, is to look at this contract and say, is this serving what we want it to serve right now? And I guess we haven't heard from the supervisors, what your thoughts are.
This is educational, without a doubt. I know that our sheriff has approached the Virginia Gay because they have some issues there with health coverage. Isn't that correct, Ron?
Correct.
Could you speak a little bit on that, please?
We had employed a in-house medical staff for the jail. They ran onto tough times and went bankrupt. We're now exploring other options to bring that back into the jail. It's a huge liability for us, not operating with it. The hospital's insurance is on board for the nursing, but when it comes time for the doctor, because they have to have civil liability insurance, they're not on board for that. So we have a proposal from one company that if Virginia Gay supplies the nurses, this company will supply the doctor. And I believe that's the road we want to go down.
With public health, you're saying supply nurses or just with Virginia Gay?
Just Virginia.
Just Virginia Gay.
Yeah, we would supply the nurses.
You would supply the nurses?
Yeah.
And then someone else would be the doctor that you could get covered
Like the
then?
medical director.
Yes.
That's what our, yeah.
And are you running into challenges with that, or what?
Our challenges are that it's an insurance game, is what it comes down to. And because if it was under the county's insurance, we already have the civil liability insurance. However, I don't know if we have it currently for the medical end. We would have to call and chat with those folks. I would doubt it.
And did I understand at the last meeting that you were saying you couldn't go that direction because of this subcontract? Is that, no, okay.
Because of the insurance
Insurance,
requirements.
okay.
We have gotten a proposal back from an agency. They will supply the doctor, and we can supply our local nursing staff through the hospital.
Costs.
Yeah, it's-
I'm trying to understand how this ties into this contract or the budgets, and maybe I'm not.
I
It
don't-
doesn't.
Okay.
It doesn't.
Okay.
It's separate.
Here again, I don't
I
know
think-
if this goes through public health or who this goes through.
Well, if this was county health,
Yes.
this might be something we could provide as well through the county health.
Yep.
You know,
Exactly.
that's what's bringing this
Gotcha.
in, okay? What's the cost of
Some of this.
civil insurance?
It raises their contract by, if they supply everything, all their insurance, their doctors, their nurses, it's $130,000 a year.
For that insurance cost?
Mhm.
For the insurance or for the doctors
For
as well?
everything.
Is that comparable, Ron, to what you were paying
Oh,
the other
goodness,
company?
no.
It is not.
More or what?
Like
More.
3 times.
Yeah.
3 times more.
The other company went bankrupt, and they said.
And you
when
say
these
that's
folks-
3 times more than what
When
they were
these folks
charging.
came in, they said, we can tell you why they went bankrupt, they're not charging enough money. They said their insurance went up, and they said they just couldn't make it work.
But we currently have civil insurance, we just don't know if it covers the medical part. We'd
Correct.
have to get a hold of Heartland and
See
ask
where
that
that
question.
Could it be a rider on there or
I don't
something
know.
even?
I don't know. Don't know.
Yeah,
I mean, that might be an advantage to going to county,
county.
you know,
Yeah.
We would have-
$130,000, that's a lot of money.
That's a lot of money.
And Becky was saying space.
How much room does it take to do
How much
this?
room do you have now? Just an office?
We have our office, of course, I have staff that I pull in as well, but, then I have a exam room up here. I run my clinic out of.
So refrigerator, freezer.
Refrigerator, freezer, emergency preparedness supplies, I have all kinds of stuff.
A room about the size of our conference room? You've been
Well,
in
our
it.
little room,
The
That's a
the
little
county.
smaller. It's a
Our
little
county
smaller.
conference.
But yeah, probably about the same.
Okay.
It's like,
Interesting.
yeah.
Okay. Who could we kick out?
I thought there was a building across from the hospital. I have to get myself oriented. No, it's across from the courthouse. That was public health before.
Yeah, that was public health at one time. It was home
That's-
health at one time.
Yeah.
That's a space.
It's privately owned now, I believe.
Yeah, I don't
I
know
think
if
it's
it's
up for
open.
sale
I mean,
or something. They want to rent it.
Yeah, it needed a lot of work,
Oh, okay.
a lot of
Okay.
renovation.
It was not. Okay,
so,
not as robust.
so
Okay.
the discussion about the benefit to the sheriff department potentially. Other thoughts from supervisors?
I know I dealt with Lutheran Home, I've dealt with Keystone. My personal opinion, I can't believe that they do much charity work. I know they do some. I know they do this foot screening, cutting toenails and all that. I don't know if that's still a practice that they do. They've done it for 4 or 5 years, I know, but
I think
don't know
I think they do.
that they do.
My in-laws are currently at the Lutheran home.
Okay, yeah, but they do it there. I'm talking, they go to churches.
Oh, don't know that part.
Yeah,
Yeah.
Toenails?
yeah.
My job was bad.
And I don't know if there's a fee for that, I don't know.
It's like my nightmare.
Home health.
But I'm thinking the other two
Everyone want
don't,
money.
you know, do too much charity work. I can't say one way or another, but I just can't, in my mind, constantly think that they do. They're in it to make money, both places.
They're both nonprofits, but
Yeah.
Yep.
Just one thing to think about as the Board of Supervisors and the Board of Health as you're thinking about possibilities. I will just share this too. And you probably know this from other things, but there's it's extremely hard to hire anybody right now. So if you are looking at potentially thinking about a county-based agency, it's going to be a while, right? I think the workforce is really tapped out.
How about if we poach?
We know how to do that.
Poach.
Sheriff does.
He does too.
I will just, say that right now. I have a number of health departments that have been struggling to keep their staff there and also hire new
Sure.
positions. And so that makes it extremely hard to meet contract requirements through the state with those grants as well. So
And-
just something to keep in mind as well.
And what is the requirement for that person?
It would truly depend on the services and activities that the county would want. It's not required that they be a nurse, but if you want to do jail nursing and if you want to do immunization and all of that, then that obviously would be a strong person.
And some counties will, of the 10 essential public health functions, some counties will say like, we're not going to do disease investigation. We're going to contract that out to the state, or we're not going to do certain aspects.
The state is willing to help with some of the contact tracing if a county is not able to do that.
And do counties have to have 24/7 public health? I mean, I know that we're paying for on-call right now. Is that a requirement, or can there be an answering service? Or
I have to go specifically and look at that. That's been a question that keeps coming up, specifically around disease outbreak investigation. And that's not my area of specialty. That is our other CADE group. That would be the area of that. But it is recommended that there be somebody that is able to be reached in case that we have a disease that comes in that needs to be followed up in that very short time.
and how does environmental health do that? Because
They
you're
call me home my cell phone.
Okay,
when
and
I
that's part of
answer.
your salary.
It's part of my job.
Okay.
Haley, what is the cost of bringing on a new employee in the county, like outside of their salary, of course? What's the HR and the
Well, even
all
like
that
just
stuff?
their insurance benefits is, between 22,000, just that alone. So then you have whatever your salary would be, and then the withholdings.
That's with a family plan, though.
Yeah, that's a
Yeah,
family
that's
plan.
correct.
I would say at least, say if it's $60,000 salary, it's probably gonna be 95,000 total with benefits and withholding.
So.
Well, I don't think we're gonna jump into any
But then you gotta house
changes
them
right
and-
off the bat
I
without
don't know where we put
a
some
doubt.
options.
You know, I think we need to get this, he's the chairman, I'm just talking. But I think we probably need to get this contract updated. And then we can always explore going forth, the possibilities, the pros, the cons.
And
you
like I
know.
said, I have contacts specifically for Carroll County, well, and Jones, but nobody that was in that transition period for Jones County is still there, I don't think. I
Sure.
think it's all changed. But Carroll County just recently went through it, so there was a lot of work on behalf of the Board of Health that had to happen. So I know that they said they would be happy to talk just through what their transition was like.
And I think the Board of Health, as well as environmental, is that what you're?
That's what
Okay, I think these two boards would have more questions than the three of us, because it's kind of in their realm.
I think too, thinking about
Yeah.
just these discussions, it'd be beneficial to do another facilitated conversation with the Board of Health and other partners probably on maybe, it may not be a strengths, weaknesses, opportunities, threats conversation, but there's a few other tools that I can look at that may be beneficial for our discussions and seeing where the Board of Health wants to go.
So talking about other funding sources too, I know Ray maybe can speak a little bit more on our opioid settlement. that the county will be getting. Currently, we have about 90,000 in our fund balance in that. I know there's gonna be some guidelines coming out here soon on some of that funding, but we're gonna continually get that for, how many years, Ryan, was that, do you remember?
Well, it depends on this new settlement that they're just offering this week. Some of it pays out in the first 5, some of it pays out in over 15. I got notice, and I've got the paperwork to sign off on joining the settlement. This one's for $20 billion with Walgreens, Walmart, CVS, and 2 other pharmacies. So they're providing also a detailed breakdown of what you can use it for. I haven't gotten that yet, but I do have the documents. I think it's on the board agenda for Tuesday so we can get those signed and join the group. But there may be some money in there for that, you're right.
Yeah, that's
And
what
will
I
they
was
be able to be subcontracted, or will those have to stay within the county?
No, we could use those.
That's just it, some of that,
Yeah.
was like ISAC, they're supposed to be getting us guidelines.
Right.
But-
ISAC's supposed to have those out this week or next, aren't they?
Well, we have guidelines for the opioid funding that we are currently getting.
Right. I think these are a little different.
The
Yeah,
settlement.
but there's some different ones coming up
Sure,
that we're talking about
but
that are more money.
Do you recall what the current guidelines are?
And that was during
with
election
the-
time when they have a webinar that's recorded, somebody could watch, because honestly,
Yeah.
that's another subject we're supposed to, have you guys appoint people to another committee for this opioid stuff.
Sure.
Well, and could, and just not knowing, could some of that money be paid to make a half-time person a full-time person and have half of their,
Again,
Yeah, who
I don't
knows?
know,
Yeah.
so.
And you could maybe tie it into addiction,
absolutely, and
addiction, suicide. Maybe you could come in that way.
Yes.
You know, it's just a thought.
that's a lot of money, and we can do a lot with that.
Absolutely.
What has been done with the money?
It,
I don't know,
I
we've
think
only
we
gotten
got-
one. Wouldn't-
Did we get any money yet, Haley?
Yes, we
Yes,
have.
Oh,
we
yeah.
have
Yeah.
90,000.
we
And
just gotta
what's
check
been done
that.
with it,
Just
Haley?
We
sitting
haven't
there.
done nothing with it yet, it's just sitting in a special fund. Well, it just, we've gotten 2 checks this current fiscal year.
Yeah, we just
Okay.
got to
So
check
it's
last
just now
week.
starting to come, and all counties are in the same.
I was gonna say, from what I've heard, many counties aren't sure what they're supposed to do with it, and they're kind of waiting for additional guidance on
Kind of
how
like
they
with the
can use
ARPA,
it.
when we first got that, it was like thrown at us, but yet, wait, see what we can do with it.
Yeah.
I wanna back up here. We're gonna use her figure that she threw out, 90,000 to hire somebody. All right? What I'm looking at now, either we're gonna have to furnish a car for that person to drive around, or it'll be mileage that'll also come out of the county's budget.
That is correct.
And then the next thing is, where are you gonna put this person? Our buildings right now that the county owns are full of people already. There is no more places to put them. I'm tired of building rooms, right, Rick?
Drywalling.
That was
So I mean, don't think the 90,000 and we can hire somebody and
Oh, no,
away
no.
we go.
No, I don't.
It's gonna be a lot more.
Absolutely. And like I said, I don't honestly have a strong preference if we stay county-based or hospital-based, truly. What I would like is the Board of Public Health to be used to set spending priorities, time priorities, and really be able to look at our community health needs assessment and decide how much do we want to spend on this service or this service. And review those budgets. I know we see environmental budgets down to the penny, and we haven't seen those for public health. So really understanding where is money being spent, what are the priorities, and being able to review that.
And this contract could be rewritten to give the board input with the hospital in terms of priorities, I think. That could be done.
And if I'm correct, you can also put expectations on reporting from Virginia Gay Hospital to the Board of Health or even to the Board of Supervisors, whether you want to see them on a quarterly basis, yearly basis,
I think it
you
was
know.
in there already.
Like a fees for service, if you're like. kind of-
Yeah, it is.
It's in here.
It's in here.
It's in the contract.
It
We're
is.
supposed to receive yearly updates, I think it's in
Well, I
here.
think we're very fortunate to have Virginia Gay, to be very honest. willing and having done it for many years in the past, willing to go forth. It's just, you know, it's our due diligence to check all aspects of it, you know, county versus, you know, contract, and I think this is the way to go, but, you know, you're right.
You know, also,
Need to have some refinements.
they bailed us out on this back in the 90s and have operated at a loss pretty much from the start. You know, that's shouldn't get lost in all this.
You know, and if they're operating at a loss, as a taxpayer, I would like all of us to know what it costs to run our public health department. We don't know if there will be changes in code that say that, you know, you can't subcontract or other things. And so really understanding what it's costing to run the public health department and funding that, I think should be a priority of all of us so that we understand what it takes to run a public health department. So while I appreciate the fact that they say they've been running at a loss, I also think it should be all of our desire to know what it costs and to understand that.
Correct.
Yes. And on the 10 essential functions, does the Board of Health have to do all 10, or can they prioritize?
No, they don't have to do all
That's
10.
what I thought. I'm just like, that seems.
So I will share with our local public health services contracts. Again, we have a tier approach. For FY24, the requirement from our boards of health through our public health agencies is the submission of their community health assessment and health improvement plan. And in FY25, we are going to request that there's some proof or evidence of strategic planning for the public board of health and public health agency. And then the following year, we're going to start looking at workforce development. So based on our CHA-CHIP, our strategic plan, what does our workforce need to meet for capabilities and competencies to move forward? And then that next year, we are going to ask for quality improvement and performance management. So how are we evaluating what the Board of Health and Public Health are doing, and how can we make sure we're taking steps to improve that? So we're making these changes to really get our boards of health and our public health departments so they have kind of that business plan. You know, our agencies should have those in place, and that's going to help them rise to the occasion of being a strong public health agency or in a strong board of health.
I'm going to just take 30 seconds of your time and say that I think I follow the East Central Region Mental Health Disability Group, and I follow their budgets and their plans and how it's falling into the 7 counties that Benton County is one of. And I see them moving over, and they're beginning to think, like Braxton's talking about for suicide, that let's spend some of our money on prevention. Let's spend a little bit of our money on early detection, which follows this broad public health model. So I think at the 2 agencies come together, we're going to see it, but it's at the local level to figure out how to proceed and integrate. Thanks for listening.
Gary, do you have any thoughts?
There's plenty of stuff to think about, that's for sure. This new employees, we're gonna end up costing a lot of money. We gotta have a place to put them.
Well, we're not saying that that's what we're going to do.
No.
You know, obviously,
It was
just
an option.
it's an option because, you know, on the map of Iowa, there's more counties that are county-based than those that are not. Michelle, do you have copies of contracts from other hospitals that, I mean, maybe
I could, but
the wheel's been
Becky said
invented,
she
as
has.
I've said before.
And it's
you know.
like she said, it's a change. I mean, this contract's, yeah.
It's
what,
old.
It's ancient.
Yeah, I mean,
Sure.
ancient, and things have changed, and I think,
I thought it lasted pretty good.
Well, no, and I just look at, probably 20 years ago when we had, 9/11, and actually the state kind of came out with all this planning and emergency planning, and so between the hospitals, and that was back when Nancy was here, and public health, to work together at some of this. And yeah, priorities change. I mean, even in the healthcare industry, it's like you're working more on disease prevention, and that's the same thing with public health. They need to look at what their constituents, what the county needs for that service.
Well, your request for additional is only 3%, very modest. I will state that. I agree with the public, the board, nice to know for sure where it's going.
Yeah.
And if there's other avenues. So.
Yeah, I mean, just looking at setting those spending priorities, and this contract requires all three parties, would be my understanding. So, I think I can speak to the people I've spoken to, everyone on the board, that we feel that that there's some aspects of the budget that we would like to tweak. And do all three parties still want to be involved? I mean, that's the other question to Virginia Gay, is if the amount of money being spent on certain aspects, home health or other things, were to significantly change, is this still something Virginia Gay wants to be part of?
Right.
And do they still want to support?
That would be a board decision, so I would, that's what, and I have a board meeting in a couple weeks, so I can.
You would discuss that with
Yep.
them and the options.
Well, obviously, not being the chairman, but I'm sure we want to be part of this. We're providing
It's
county
the
funds.
taxpayers' money.
That's
We're providing
correct.
county
We answer to.
funds for it, so, yeah.
Yep.
I mean, and knowing we're paying on-call wages to Katie and Amanda, but not to you doing on-call, there's just some discrepancies there as far as we as a board, what we're allocating those funds to.
Can I ask this? How many times do you guys have a meeting about what we're doing today?
We've never been, to my knowledge, been presented a budget for the money that's allocated from you. So we have meetings. We're required to have at least 6 meetings per year. Gary comes to those meetings. We do annually on our agenda review environmental health budget and approve wages and the budget for that. We review, at those meetings, we usually have a community person come and talk about services in the community. We discuss what diseases have been investigated. We discuss audits on vaccines, all of the work. We get reports on what activities have been billed to the local public services grant, so the state grant, but we do not get any information about the county funds.
As I don't think you've gotten a budget and had it. It was my understanding
No,
you did not.
There's quite a few allocations that we do provide out that we don't always see the dime spent.
Right.
Similar with the development group, fair board, county.
You don't know where the
allocations.
money's going for sure.
Is that best practice?
No, not always. Certain things by code, like the fair, we give them a certain amount regardless every year, and they're supposed to utilize that for like ribbons and things. I mean, there's different ways, so this particular one we're talking about was always kind of based on that original contract.
Right.
So when I first took on in 17 to do the first budget, that's where I was like digging, like, okay, most of these people are coming forward, and so I kind of started asking for updates. And then we got to the discussion with Mr. Thompson about revising, and then
It died.
Yeah.
And that was
So,
a long time
that was
ago.
probably in 17, I would say.
Yeah,
I think you're right.
Yeah.
I was gonna say 6 years.
Because I know
ago.
Barb even did like notes and stuff.
And there was a draft contract that was made, and I think 19 that I have, but it was never,
Nothing was.
it never went anywhere.
I don't think we saw the draft.
I have
got a
it.
copy of it.
I mean, it's,
Yeah, I don't think it ever come to the board or anything.
it didn't. It died.
I looked for my office, and I don't have a copy of it either.
I can give you one.
Okay.
I have it.
I only printed 4 copies, but I can. Do you have it?
I think I have this, did I not? You can look and see if this is.
Anybody else
for-
want it?
Let me see if it's the one I have.
Tracy and Gary.
Tracy, Garrett, you can give these to the supervisors.
Changes have been highlighted since you're,
Oh, okay. I'm guessing this one. Oh,
I don't know. I'm sure. Look at it.
It was Melissa and Caitlin Emmerich, I believe.
And I
And
was
it-
in a couple
and it-
of those
this
meetings
is not
as well.
one. I think a little different.
Yeah, it was, I was not involved in it.
I would have to.
I think it was Melissa
Final.
Smith, Caitlin Emmerich, who was chairperson at the time.
See if I have mine.
Yes.
Yeah,
Okay,
I'm available.
okay. This is what's changed, which is,
I spent 20 years ago.
And I just handed out my last copy, but I would just, I think making sure we have those, you know, accountability and advisory role of the board would be my big priority.
Okay, kids, that may be mine.
And I will see if I can get some other
Not
examples
giving
of
it
other
up to you.
hospital subcontracts with the county Board of Health.
So then you guys
Is
will
it
work
the
out
same
the
one
contract.
James provided? 'Cause if
Well, I
it
guess
is,
that's, I mean, you said you're taking it to your board?
I was the same one.
Thank you so
it
much.
is, it is.
Perfect, and I've got one here that I've.
And this is the structure change that she's talking about. Perfect. Okay. So
Michelle,
somebody tried to get the bigger picture at some
Do you have a way
Yeah,
of
19, but never came forward.
Yeah.
telling us what money you would actually need to meet all the expenses?
Focus.
So if we,
I would have to have Barry do a budget, yeah.
well, that would be good to have when we're doing this contract to know where you're really at,
Can I hang that to this?
and then the board could maybe plan around that.
Yeah, I mean, could we have that by our next meeting, March 15th?
March 15th. Yeah.
So for current budget year though, we're probably gonna have to move forward as is because I have to have the budget done.
Oh, yeah.
And is that amount of facility fee standard? I mean, for, you don't really have anybody else you're subcontracting.
It's just, yeah, I just was reading here.
No, so like developer group, we used to
I
pass their amount to them and then they run their office and salaries out of that as well.
And I
So, yeah, I don't know what's,
One, do you keep track of in those line items pretty closely, or is
but
it?
this is different because some of those departments will submit invoices to us and then I pay it out of line item, like normal.
I can't find
This
it.
is different, yeah, we're like the pass through.
And do other,
Go through A, B, C, D, F, G, H.
do other boards of health receive the funds from the county and then disperse them to the hospital?
So there's some that most have the Board of Health funds, so the Board of Supervisor funds go to the Board of Health, and then the Board of Health
As their line
has
items
that
come in.
contract with the hospital.
And that's not how we do that.
Yep.
So I'll address this to you. You handed these contracts out. Did you like it? Think it was all right? Or
I mean,
no?
I haven't dug deep enough into it. I wasn't involved in I actually admittedly was like, oh crap, I have that, and printed it off right before I came. So I would need to take a better look at it, admittedly. You know, what you were saying as how the funds get dispersed, I think is something that needs to be discussed and thought through. Do the supervisors want to send the money to Board of Health and the Board of Health then disperses the money to Virginia Gay so that the Board of Health has that control? Or do the supervisors like the fact that you disperse it directly to Virginia Gay and that Virginia Gay then ultimately the budget comes back to you to review and decide if that's so just seeing how that money flows, I think, is an important thought that we need to think through. As a Board of Health, I'd like to be able to say these are our priorities. We've looked at, you know, we're the people that you've appointed to be on this board to review the needs of the community. So I would like to see that, so that those funds flow in that direction. But I mean, that's a decision for all three parties to have together. And I gave you my last copy. So
Well, and I will say, even the counties that have the funds from the Board of Supervisors put into the Board of Health budget fund, many times the public health or the hospital agency is still going to the Board of Supervisors to provide updates, just as an overview, because it is the county tax allocation. So it's really recommended that that communication be open and that transparency is there, because it is those county dollars.
Sure. Which makes sense.
Absolutely.
So if you want to oversee Virginia Gay, I guess I'm looking at, then I would like you to report to the supervisors meeting.
I would love that.
You know what I mean?
I would love to get those all that information from and report, just like any other, county board would do. And if we feel like we don't have enough in our budget because we have X, Y, or Z thing that we want to do, to be able to come to you and say,
Discussion.
we really feel that this is a need in our community, and see, where in the budget do we want to, if there's not room to make that up, be able to ask for more funds.
My feeling is, I just assume if we could, if Ray can word it somehow, that we still pay Virginia Gay, my opinion, directly. But yet you guys got your fingers in, looking at everything going, and if you see a problem, or I guess I'm looking like, all right, it's May and you went through the 93,000 and we need some more money, then it's up to you, the board, to come to our board and ask for a little bit more money to finish out the fiscal year.
Well,
That would
if
be an
that were the
amendment,
case, then I would say that would be Virginia Gay that would be asking for more money, since
Right.
they're the recipient of that money.
If they're gonna ask,
they're
they
gonna
should
have
be in
control of it.
control of the funds, honestly. And I don't see that as a bad thing. And I
We have an
think,
engaged board. We have a very engaged board that wants. We've
Yeah.
gone through this pandemic. We're thankful for the leadership we had in place. We're thankful for Katie's work. We need to have a strong board of health, so that if and when the next thing comes, we are poised and ready. And I think having full transparency and full priorities should be all of our goal in making sure that public health is as strong as it can be. And being able to say, this is really where we need to put our money towards, and with that shift in public health is not what it used to be, and spending priorities need to change with that.
well, I like the idea that, you would come forth quarterly reports, that's how other departments do it. And because quite honestly, I had no clue that there was a change from public health, away from home health, as far as the state goes, So, yeah, I mean, it's good to know.
Do some counties spend no money on home health? Or
Right, we have some counties that don't spend any of it.
Contribute at
Yeah.
all. They just use it all for public health. I see.
And with only nine people, that's taking a lot of focus
yeah,
away from what, in terms of Katie's time.
9 people,
That's-
$2,500
That's,
Yeah.
a
that's
month,
significant.
is a chunk of change.
it is. And there are avenues in place for, those 9 people need care. I'm not discounting the fact that there are some very bad situations where people need help, but
Right.
social workers, we have options, and just like Virginia Gay does provide sliding fee scale for their clinic services or for things that patients who aren't insured, nonprofits can do that. So they can continue to offer sliding fee scales for services.
Well, I think, personally, I would think that if the health board wants to be the recipients of the county funds, that should be part of the agreement. I mean, a decision made and be part of the agreement. What do you think, guys?
My question is though, if we turn this over to you, that you're gonna report to us, we're gonna fund you directly, you're gonna have more than 6 meetings a year.
And we're fine with that.
Okay,
We're aware of that. That's the minimum required by the state, but we're aware of that.
We have many boards of health that meet on a monthly basis.
For lunch?
Oh my God.
Typically, it's like
I was
7:30 in the morning and 7 o'clock
asking
at
if
night.
it could
It's
be lunch or
breakfast.
something.
It's breakfast.
No, state funds can't be used for food, so sorry.
I was just thinking.
Yes, but thank you. Thank you for thinking of that.
Anything else we need to do?
No?
I don't believe so.
I think this is good to
I
get together.
wouldn't be against funding you guys directly. At this point, anyway.
Look into that.
Part of the contract.
Ray, do you need
Three
anything from
parties.
us at this time?
No, I'm sure I'll be talking to Becky, and my only question is what protects the hospital in that situation? Because I know that's what their question's going to be when I sit down with them. Obviously, if it goes through a board, the board could redirect it away.
What do you mean redirected away?
Well, if some other service you felt outside the hospital was more important for public health, you have a responsibility to pursue that. And I'm sort of brainstorming out there a little bit, but
Well, they would still,
The Board of Health is still, from our discussion, I think the Board of Health is still okay with Virginia Gay being our public health, recognized public health agency is what we typically call them.
that may change.
Could.
It
It
could
could.
change, and that's why I'm asking is,
but if Virginia Gay says they aren't making any money on this and they're losing money, I don't see,
Do they want to keep the contract, Ray?
maybe,
That's
or
the,
maybe since we're renegotiating,
that's
are
the
they going to want
discussion
more?
she wants to have with
Are
her
we gonna
board.
want more?
Are they going to
or
want
we
more
gonna
since we're
separate?
renegotiating? Is what I'm wondering.
Well, they're,
Well, they put in their request.
no,
Yeah.
and they have attorneys to protect them,
I understand that.
and we have attorneys to protect us.
and I guess I don't understand what you think they would, if the money came to Board of Health and the Board of Health signs a yearly subcontract to provide service to, just like we yearly sign over our state funds to Virginia Gay. So we sign over the entirety of the $62,000 to Virginia Gay, and that is renewed yearly, and there's a 30-day clause.
So you want to break down within the 62 for specific purposes that they perform.
No, so the state funds is $62,000.
Right.
That money comes to the Board of Health. The Board of Health signs that over to Virginia Gay.
Right.
So that's what would protect Virginia Gay, is that then if the county funds, that
Okay.
90, came to the Board of Health, the Board of Health would subcontract that to Virginia Gay and would say, these are the things we want you to do with this money, and we will decide
The
how-
allocations.
The allocations. You will get that full 90, but we will allocate what that's being spent on. And then that contract would be renewed annually to make sure that it still is agreeable to all parties.
Okay.
So really modeling it after the state contract, which is a yearly review contract for the state funds.
So then I guess the question is, where's the hospital in all this?
I would have to review the contract and what is written up and with
So
our
you'd rather
board
just-
and
just-
decide if we want to keep it.
You'd
or not.
rather us present you with something, or you want input on the front end?
I really need to discuss with the board which direction they want us
Because it
to
might
go.
work better if we had your input on the front end, so we would know.
I don't know. I don't know if it's something we would want to, public health is kind of out of our realm. Maybe we just go with the home health and focus on that. I don't know.
Because you
Sure
haven't
did.
seen the numbers yet either. you don't have the numbers so that you could make an informed decision about it.
Then I think it might be prudent to wait till after you meet with your board and discuss the issue. I don't want to draft something and have you say, well, no, we're interested, sorry.
Nope, that sounds fine, right? That sounds fine.
Well, the public health, Katie, I mean, you did a phenomenal job with
Yes.
COVID. And so, I mean, I realize that may not be your,
My take?
but it you really did a
Still working
great
on
job.
COVID.
So, yeah.
I appreciate it.
But, okay. All right. Have we beat it to death enough?
I think
Yeah.
we have. Anybody have any
Yeah.
other questions?
Motion to
We've had
adjourn.
public comment. I'll make a motion. I'll entertain a motion to adjourn.
Second.
Oh, sorry. I will entertain a motion. You'll first.
First.
Second. All in favor, say aye.
Aye.
All right. Thank you, everyone.
Thank you, guys.
Thank you.
We're adjourned. We're adjourned.
Thank you for holding us.
Yes. Thank you.
This was a
Nobody heard that.
tough one. It was tough, all of the rehashing.
Yeah, it's just, get up here and talk.
Nice to see
Things
you.
I didn't know about.
Mackie, we really appreciate you driving on. Thank you.
I do appreciate, yes, you did, a lot clearer.
Yeah.
Cold in here.